Well, joining me now is a man who's in the middle of fighting this outbreak, key minister Sidharth Nath Singh. He was former health minister also of Uttar Pradesh. Mr. Singh, what are the challenges specific to Uttar Pradesh, India's most populous state? And we saw this of this young man in Gorakhpur who they wasn't aware, the doctors didn't know of his travel history. He'd come in for what he thought was a normal illness and then was found to be corona positive. What would you tell people is key today?
I think Sonia, the reporting has been little incorrect. The DM is already on record. The bite of the DM that you showed of Gorakhpur is a half bite. Before that, he gives the full reasoning of his death, the how and how he was brought to the hospital from Basti. Now, when in Basti, there is a fact that he was being treated for renal problem. And he had an acute renal problem, for which he used to go to the district hospital in Basti. And from there, when he came there, he was asked of a travel history, which was certainly not told to the CMO or the district hospital. Then, since his condition became serious, he was transferred to the BRD hospital. When he went to the BRD hospital, Sonia, he was admitted straight into the ICU.
Right.
Not into any general ward. He was taken to the ICU. He was kept in the ICU, and there was only one patient in the ICU. And from there, the next morning he was transferred because they suspected that this could be a case because the family kept on denying it. And since he had a renal treatment problem, so obviously he was being looked at it. But while he was being transferred, I believe, from the ICU to the isolation ward, they took the sample, but it was a bit late. He had already expired. And then the doctors did come to know that he is a corona positive. So this is the fact. So I would just request that, the way it's been put across is as if it was somebody, the doctors were actually clueless how to treat, what are they supposed to treat. And let me also add here, the BRD Medical College, since we came into government, and I'm sure you do remember the 2017, when a lot of hue and cry was done. And I was the health minister, and I just left about 6-7 months back. BRD Medical College has been really ramped up from not only the infrastructure, but from the training of the doctors and training
of course, and let me clarify right here.
Yes. When we get at the biggest respiratory problem is the JE and AES in that part of Uttar Pradesh.
Of course.
Control that.
So let me clarify here, Mr. Singh. We are not saying that this is a blame game or this is that the doctors were clueless at all. In fact, we haven't used that word at all. It was actually just a point that, as you said, he did already have kidney problems. So there was no suspicion of the fact that he was corona positive at all. And even though, I think again the story does say that he was in ICU, the point is that doctors didn't treat him as a corona positive patient because they didn't know. My question to you is, especially in a state like UP, which, as you know, the government figures have, that has been in health facilities, and this is not just about you, but successive governments has been lagging in health facilities. The number of government beds per person is something like 2,000. I think the statistic is to a government bed ratio, just because given the population and the facilities there, how does a state like UP deal with this challenge, as opposed to, say, perhaps a state like Kerala, where the health facilities are much better off?
Well, certainly we can't compare ourselves with the down south. And we have been ramping up our health facilities. And, well, if I do take on the national average, it's 1:10,000. That's the national average. So it's a very poor when you look from there. So I'll not get into that side, the budgeting side. Right. But certainly we have been ramping up. And as of today, I do understand that we have about 5,000 beds which are kept in isolation in various hospitals. We have taken the various, private hospitals have been already taken in. So, there will be enough beds. But we have also made an immediate arrangement to add on 10,000 beds wherever it is required in any district, wherever it is required, that can be brought up in 48 to 72 hours. So that's That's the arrangement we are keeping.
Right, and of course, Mr. Sidharth Nath Singh, Uttar Pradesh, one of the states where we've seen a huge influx of migrant labor. The attempt is to first quarantine them before they get back to their villages. What for you is the big focus that Uttar Pradesh must focus on now in their own unit? Because each state has different issues and different ways of handling and different problems, different challenges. What for you is the biggest problem for Uttar Pradesh? Is it the arrival of migrant labor? Is it the fact perhaps of facilities? You said you're ramping up beds, but the worry also we saw Uttar Pradesh ambulance workers say they hadn't been paid salaries. They went on a one-day strike till the salaries were paid, and that they don't have proper protective equipment.
Well, I won't go into the ambulance side because it's an outsource. It's the PPP model we are running with the Hyderabad company. But as far as I would say that biggest challenge to us is what has happened of the labor class, getting into Uttar Pradesh. Now we are, well, it's a little unfortunate. Every government should have looked into this issue. For the way we did on 17th of April, after the cabinet meeting, it was decided all the labor class, the daily wages will be paid 1,000 rupees by the government immediately, and that was done by our government in 72 hours. So this type of things would have held on to the laborers wherever they are. Right. But unfortunately, it did not happen. No blame game here again, I would say. Right. We're fighting together this war. And so that challenge is the big challenge because it's over a lack of them. And we are doing our best. For example, I am individually, we are, as minister, we are individually also in charge of various districts. So something came into my knowledge, which is Gonda, which is next to Basti. And there I was told that about 400 of the labor class were actually crossing. So what should be done? I immediately ordered that they should be taken into and quarantined. They shouldn't be allowed to move around. So that kind of arrangements we are already doing. So all ministers are looking into.
We wish you all the best. Yes, we wish you all the best with that challenge, because really, in a sense, how Uttar Pradesh managed to control the outbreak impacts India numbers, given that it is the most populous state.
I do agree.
So all the very best with that battle and outbreak.